Andrew is on his poultry farm to check on his birds after he observed an unusual sound from them in the night.
One of the main problems on the farms are chronic respiratory diseases. So you realize the birds snore very deeply at night and make noise.
His quick fix to curing and preventing the infection is an antibiotic. Every morning, Andrew adds an amount of antibiotics to the liters of water he serves his coops, housing over 3,000 birds. This, he believes, is necessary to protect the animals from any unforeseeable disease outbreak.
The antibiotic I used recently was a drug called antibiotic-resistant. We have realized that to wait for the animal to get sick before you treat usually will require the use of very complex antibiotics and using them for a very long time. So we have just designed for ourselves that we give them antibiotics at the end of every month just to prevent diseases. So, but even with that, sometimes you may still have infections on the way. So as for the routine monthly administration of antibiotics, it is just by convention. The way we've been operating the farms, we realize these things do help.
Andrew has been in the poultry and livestock farming business for nearly 2 decades. This has been the daily source of livelihood for himself and his family. In the past, treating common bird infections came easy, but now it is a real struggle of switching among a plethora of antibiotics.
I started this whole poultry somewhere in 2008. And those days, I remember when you buy antibiotics and you just give to the birds, the first day, you see changes. These days, wow, it's not so. Sometimes you will give the recommended dose and still the birds are not responding. At times, you may have to prolong the period. So instead of 5 days, you may have to go about 7-10 days before you start to see certain impacts on your birds. Even some of the drugs, they wouldn't work at all. At times, you may give different other drugs prescribed by the veterinary officer. After doing whatever assessment he has to do, he prescribes the drugs for you, you will use it, and the birds will still be dying.
The phenomenon experienced on Andrew's farm is what medical professionals and scientists refer to as antimicrobial resistance, AMR. AMR essentially is when microbes like bacteria, fungi, and viruses resist the effects of their known remedies.
These are very worrying times that we find ourselves where
Dr. Peter Mensah Amponsa is a senior veterinary officer with the Veterinary Service Directorate at the Ministry of Food and Agriculture in the Ashanti region.
It is only normal, especially in our current days, that poultry farmers would use certain antibiotics that previously were very effective and now they are not effective, and then they sometimes will put it on the fact that maybe the drugs are substandard, maybe the veterinarians gave them a wrong medication for a particular disease. But then we keep on trying to tell them that this is a new phenomenon that is coming up, which is antimicrobial resistance. Because of our continuous abuse of these antibiotics, over a period, the bacteria are also evolving to be able to outmaneuver these bacteria or these pathogens or germs that they use to be killed easily by these antibiotics. So yes, they are right to actually say that for some time now these antibiotics are not working. Even aquaculture, fisheries, they are also using a lot of antibiotics.
Antibiotics, first developed in the early 1900s, are a class of drugs used in fighting bacterial infections in people and animals. They were indeed a breakthrough in the field of ancient medicine, but 100 years on, they are becoming one of the most abused drugs. Professor Richard Odame Phillips is the director of the KCCR.
Coming of antibiotics, we thought was a breakthrough for humankind. But it wasn't long after that we noticed that it's becoming a big issue and headache for us. Reason being that we have misused it or we have overused it in different settings, either in the environment or in the hospitals or the vets. They all use antibiotics, and eventually it didn't take a long time before we realized that now what it is meant for, we are not able to achieve it, and that's the problem of antimicrobial resistance.
A worry among health experts is the emergent transfer of these resilient soldiers from your favorite meat to humans. From the fleshy cow meat to the tasty poultry, researchers are finding transferable resistant genes from animals to humans and vice versa.
If I give my animals a lot of antibiotics, we call something withdrawal period. So it means that once I am giving, let's say poultry, once I'm giving the best antibiotics, there are residues of the antibiotics in the eggs. So unknowingly, you the human being will also go and buy that particular egg, and you will start consuming that egg. So you don't think you are consuming ciprofloxacin, but because you are buying eggs from our local markets and these farmers are not observing the withdrawal period, you are always all the time eating antibiotics unknowingly. The best are on litter. So if we don't properly dispose the litter well, and then maybe it rains, some of the antibiotic residues and then the bacteria that are very resistant may seep into our water bodies, and people will just go and drink some of these water.
This trend, coupled with abuse of over-the-counter drugs, are compounding the impact of AMR on humans, animals and the environment. This is evident in various health facilities across Ghana as medical doctors struggle to treat certain infections that originally responded to a known drug. The Agogo Presbyterian Hospital is the foremost health facility in the Asante Achim North Municipality of the Ashanti region. The hospital receives over 100 medical cases daily, with each requiring a specific treatment. But the plaguing trend of AMR is on the rise at the hospital. From recording an initial lower number to a growing statistic, doctors at the hospital are faced with the challenge of delayed treatments. Dr. Samuel Same is a medical officer at the hospital.
So in the past, Fluclox, usually a first-line medication for something like cellulitis. You used to give in about 5 days, patients get better. If the sequelae of the cellulitis takes its own course, then you know what to do. But now, you do Fluclox and you don't see any result. So you may have to go higher up, okay? And even now, we are tempted to even start, say, clindamycin as the first drug of choice.
The World Health Organization reports antimicrobial resistance as one of the top 10 global public health and development threats. It is estimated that bacterial AMR was directly responsible for 1.27 million global deaths in 2019 and contributed to 4.95 million deaths. Available data from the Institute for Health Metrics and Evaluation reveals about 5,900 deaths in Ghana were directly attributable to AMR in 2019 alone. The situation is frustrating the work of health officers.
It becomes frustrating, okay, because healthcare deals with human lives, okay, because the goal of our treatment or the goal of our management or the goal of our practice is to make human lives better. Okay, so if it would have been easier for me to start from a certain point to make a life easier, but now because of the abuse of antibiotics, I now have to start from a point where I may have some struggles getting medications from the patients because of complaints of financial constraints. It becomes frustrating to me as a clinician, number one, then to the patients too.
A rather disturbing trend is the increasing cases of antimicrobial resistant bacteria among children in Ghana, which is escalating into a silent crisis. Data suggests the largest number of deaths associated with AMR in 2021 occurred among those aged under 5 in the country. This is evident at the hospital. Dr. Prosper Dapila is a pediatrician at the hospital.
If there is some resistance and I've started my medication, say 3-4 days, they're not responding, I'll have to switch them next tomorrow. They've been there for a number of times. Even where the parents will sleep may be an issue because they are on admission. But now the mother will now have to stay extra. So costs, feeding, then the duration of treatment also. Now, if it's a bad condition and I give the antibiotics, I expect antibiotics to work so the child gets better. But if the child is now resistant to it, the antibiotic is not going to work, so the child will probably eventually get worse. And by the time we will get the results or switch to the second line, it may have gotten to the point where we won't be able to do much about it.
Researchers at the Kumasi Center for Collaborative Research, KCCR, have in the last 5 years spearheaded research into antimicrobial resistance in parts of the country. Under the One Health Bacteriology Project, satellite laboratories have been established at the Agogo Presbyterian Hospital and other communities located in the peri-urban areas of Ghana through an ongoing AMR surveillance. The laboratories support the hospitals with bacterial identification and antibiotic susceptibility. At the Agogo Hospital, the result is evident in the bacteriology lab set up to investigate the growing cases. Blood and urine samples taken from the hospital undergo careful investigations to uncover the stubborn microbes.
The doctors request for blood cultures frequently for the newborns when they are suspecting neonatal sepsis, or sometimes when the fever, the temperature is high. Because they are newborns, their immune system is not that developed to be able to fight against the infection. So immediately there's a spike in the temperature, they request for the blood culture. So in a day, I can say that you receive about 15 to 20 samples, but on average, say 10. Meropenem is the highest class that is able to fight against the bacteria. But recently, the bacteria is now able to fight against the meropenem. So if you don't take care, maybe in the near future, it's likely that meropenem the bacteria might become completely.
When they come here, what we do is we go further to find out if the resistance they are seeing, if the bacteria has those resistance genes. We cannot deny the fact that the resistance genes are the main drivers of resistance, because normally they are being carried on their chromosomes in the plasmids, and also they are able to share to other bacteria, which makes it a very big problem.
Data from the center, together with other satellite laboratories at Agroyesum and Asimfosu over the last 5 years, show worrying cases of antimicrobial resistance in bacteria. Dr. Charity Wiafe Akenten is a microbiologist and project coordinator.
So we are seeing a lot of resistance to our 3rd generation cephalosporin. And when I say that, it's like our antibiotics like cephalosporin, ceftazidime. We are seeing a huge, over 50% resistance to it. If I should compare what is happening with the Agroyesum, Agogo, and Asimfosu, you realize that the resistant pattern changes. We saw huge resistance. And I can tell you there is an antibiotic called meropenem. It's really not common, right? And it's one of the antibiotics that has to be used when nothing is working. And when we work with Agroyesum, we realize that we are having over 40% resistance to that specific antibiotic. But that resistance are not seen in Agogo or in Asimfosu. So it is important for us to know what is happening at every site and what is going on.
The local research shows how costly AMR has become for Ghana's health system. Patients with drug-resistant infections are spending more days in the hospitals compared to those with susceptible infections, incurring nearly $100,000 to each admission. This is also compounding the financial costs absorbed by hospitals.
A higher class medication means more cost. So if now the most basic first line medication can't cater for the infection you have, it means you're going higher up. People have the notion that insurance is actually catering for most of the medications. Let's say insurance can cater for everything that amoxicillin costs, but maybe for ceftriaxone is something else. So it can only cover for something small, and the patients have to top up. We as a community are compounding or adding on to our own economic struggles.
The cost burden isn't the only concern, but also patients being exposed to more dangerous germs in the hospital.
If you come and the antibiotic we are giving you isn't working, and for that matter we have to admit you to give you some form of parenteral antibiotic, now you become exposed to a greater risk or maybe a more dangerous infection.
AMR puts many of the gains of modern medicine at risk. Along roads, in buses, and at various corners of rural communities and urban centers, the unregulated dispensing of medicines by individuals posing as prescribers is contributing heavily to the menace. Dr. Aloysius Loglo is a postdoctoral research fellow at the KCCR.
That is even difficult to manage. First of all, you can't tell even if the medication is the right thing or even if it's fake. You can't tell. So for that aspect, there should be a law that should stand against it. Because people are taking medication into their bodies. We don't know what is going to happen. And somebody is basically hawking medication. It's something that we should have a system that should make it illegal. If we want to handle AMR in our country, we need to be tough with our policies, and we need to be tough with how we implement the policy.
The Ghana National Strategic Action Plan on Antimicrobial Resistance, enacted in 2017, aims at improving and sustaining the health of the population and enhancing food security. It focuses on the responsible use and access to safe, effective, and affordable antimicrobials, as well as the slowdown of the emergence of resistant microbes and the prevention of the spread of resistant infections. For both the human and animal sectors, a simple routine of stricter hygienic conditions is necessary.
Just washing your hand and making sure that we have proper hygiene practices is a big thing, and it can help curtail this problem significantly, and not looking up to medication. Because if you have the antibiotics, it does not mean that that alone can cure your illness. So prevention plays a very key role. Our food practices, our hygiene practices, we need to pay attention to them.
People who are not supposed to be on the poultry farm, they could be carriers of diseases. So everything that you put in place so that such people are not able to enter the farm, you are putting in measures to really prevent diseases from entering your farm. So that is one of those things. So a farmer can just have a simple barrier to the farm so that not anybody can just enter. Even if you are entering the farm, they will have some disinfectant that you step in so that the soles of your feet get disinfected. Some farmers too will give you a new coverall to wear so that you don't carry any other thing into their farm. Vaccinations, I mean, if the animal is vaccinated, COVID came and then it was a virus and people were given antibiotics. So in the animal health space, we also believe that if we are giving vaccinations to these animals, then we are reducing the disease burden on them. Then in effect, we are not using a lot of antibiotics on some of these animals.
Stakeholders are calling for concerted and collaborative efforts to fight the menace, as many people fail to appreciate the looming health crises.
The best way to manage that is to engage, is to get them involved in the whole AMR process. Maybe it should be starting from the veterinary system. We should have a system in which if people have farms in a particular area, we should have a veterinary officer who is basically ensuring that the right things are being done.
Trying to address this problem, you need to get minds together, and I think the biggest thing is the education that sort of brings all of us together, because the more you talk about it, the more people realize that, I mean, doing it alone is not the way to go.
The WHO posits that over 39 million deaths could result from AMR between 2025 and 2050. Without urgent interventions, an entire generation of both humans and animals could be soon wiped out.
I know that it takes longer, over even sometimes 10 to 20 years before a different pipeline of antibiotics can be released. And so I believe with the impact, it can also lead to high mortality. You see, in Ghana, a lot of us cannot afford. And so if you go to the hospital and you can't afford a huge antibiotic, at the end of the day, you end up dying.
If we don't use simple approaches, we may end up cheating ourselves because the new ones are not available, and more research has to be done to be able to. But how many new antibiotics do you want to be making? Because the bugs or the organisms or the bacteria or viruses or the bugs, if I put it in simple terms, they are also always developing wise ways of avoiding the drugs that we try to use to kill them. So I think the simplest approach is more of prevention, and the preventive actions are so simple that sometimes we forget that those are the simplest and easy and cheap approaches.
A silent epidemic is emerging: antimicrobial resistance. Without proper policies, adequate research, an entire generation could be wiped out if humans and animals are not protected now. From here at Asante Achimagogo in the Ashanti region, my name is Emmanuel Bright Kweku.